All right. So I'll just call the names as I see them on my screen. And if you want to just state your name and the agency you work for, if there is one, and what you do if it's relevant. So we'll start with you. Well, I'll start with myself. I'm Carolyn James. I work for Kodak Behavioral Health Care. I do community outreach and I'm the prevention liaison. I have a long background in prevention. When our tobacco program is up and running, I'm the tobacco cessation coordinator. So Rachel, you're up.
Hi there, I'm Rachel Newman Green. I'm Deputy Director of the city's Healthy Communities Office, and I will be supporting Carolyn and helping with this, helping drive these in the next couple of months. I did want to announce that Obed unfortunately is out sick today, so she sends her regards to everybody, says hello, and we'll be back soon.
Okay, Adelina.
Yes, hi everybody. So this is my first week actually as the outreach coordinator for the city of Providence, and I'll be working with Obed and with Rachel, and I will be attending these meetings as well, and I hope to get to know you all even better.
Welcome. Welcome. So Jose Luis.
Hi, everybody. My name is Jose Luis Suazo. I work for Providence Housing Authority. I'm a resident service coordinator. I do social services for 3 high-rises. And right now I'm also following up with all COVID-related calls and our testing that we've done, and also the vaccinations we've been doing. And that's pretty much it.
Important work. So we all do important work, especially during COVID. So Light, did I say that correctly?
Yes, you did. It's a very easy name, so don't stress it. I'm Solite Sue. I'm the wellness coordinator for Providence Public Schools. I help oversee the district's wellness policy and provide support for nutrition, physical activity, and mental health, along with a team of people. I also work very closely with Rachel Newman Green for the Healthy Communities Office.
Great. And Jennifer Romans.
I'm Jennifer Romans. I'm the services specialist at Smith Hill Library, which is part of Providence Community Library.
Great. Tanya Gilbert.
Hi, I'm Tanya Gilbert. I am the program manager for the Healthy Communities Office PFS grant.
Michelle McKenzie.
Hi, everybody. I'm Michelle McKenzie. I work at the Miriam Hospital and run PONI, which is Preventing Overdose and Naloxone Intervention.
Jeremy Doucette.
All right, here we are. How are you? I'm Jeremy Doucette. This is Detective Shields on the side of me, Providence Police. We're part of the License Enforcement Unit. And we're here, I guess, join in and see what's going on. That's all we got.
We're happy to have you.
Thank you.
Okay, so Mensa, I'm not sure if I said.
Sorry. My name is Mary Rose Mensa. I'm the resident services manager for Pawtucket Housing Authority. We are doing a whole lot here. We're also at Lake Providence working with COVID vaccination clinics, and we were recently a recipient of the 10,000 Chances grant to be able to distribute Narcan throughout our properties in Pawtucket.
Great. And Nelson Morales. I think you and I corresponded, right, about opioid treatment?
Yes, I got it.
Okay, great.
How you doing, everyone? My name is Nelson Morales. I'm the wellness coordinator here at Providence Housing Authority. I work with residents who struggle with substance abuse and also provide support to people who have mental health as well.
Great, thank you. Did you want to say something, Laura?
No.
Oh, you're square lit up.
Oh,
So Karen Kaplan, how are you, Karen?
Good, how are you, Carolyn?
Good.
And everyone else. I'm the coordinator for the Family Task Force, and we help families who have a loved one with substance use disorder.
Great. Laura, you're up.
Hi, I'm Laura Spelt, and I am in private practice for both the Pawtucket and Providence areas. And I also do clinical work at Butler Hospital.
Great. And Lisa Tomaso. How are you, Lisa?
Good afternoon. Hello. Good to see you all again. Lisa Tomaso. I'm the Vice President for Strategy and Public Relations for the Hospital Association of Rhode Island.
Alex Gonzalez.
Hi, I'm Alex. I'm the fiscal coordinator for the City of Providence. I work with Rachel and Obet, and I'm just recording the meeting today.
Okay, great. Thank you. Dennis Baylor.
Yes, hello, everybody. Thank you. My name is Dennis Baylor. So hold on, let me put my camera on for just a moment. My name is Dennis Baylor. I'm the Overdose Prevention Program Director here at Project Weber Renew.
And Jennifer Rancourt.
Hi, my name's Jennifer Rancourt. I am the Opioid Treatment Program Community Liaison over at Discovery House for both Providence and Woonsocket location.
Great. And just scrolling over. Oh, Colleen.
Hi, everyone. This is Colleen Daly-Doy. I'm the Executive Director of Project Weber Renew.
And Zach Kenyon.
Hello, everybody. Zach Kenyon, Providence Fire Department.
Let's see, Laura Conkey.
Hi, everyone. Lauren Conkey. I'm with the Drug Overdose Prevention Program at RIDO.
Great. And Sarah Martino.
Hi, I'm Sarah, the Deputy Director at the Center for Health and Justice Transformation.
Great. Well, welcome, everyone. I don't think we missed anyone. Is there anybody who needs to introduce themselves? Okay, great. Then we'll move along. So Rachel, did you want to talk about the adjustments to the agenda today, or do you want me to go ahead?
And I'm happy to do that. Dorothy from URI will not be able to join us today. She was going to be giving a presentation on the coalition member survey that was conducted. So she's hoping to be able to join us for the next meeting, but seeing as that was going to be, a chunk of our agenda today, and also seeing as I have a conflict, we're hoping to wrap up today by 4 o'clock, which I think we should be able to do no problem.
Okay, we're at approval of the minutes. Anybody want to make a motion to approve the minutes from January?
So moved. I move to approve the minutes.
Right, and a second?
Second.
Great. So it's time for announcements. Does anybody have announcements about anything happening in their community or at their organization? Michelle.
Yeah, I have an announcement. I wanted to let folks know, and Rachel, I'll send you the flyer so people, if you don't mind sending it out to everybody. There is a new a service that is available at Genoa Pharmacy, and the only Genoa Pharmacy in Providence is the one that's co-located with the Providence Center on North Main Street, which is across from the Whole Foods Plaza. They're doing a couple of things. One is a service that's offered, which is withdrawal support. So if someone is experiencing opioid withdrawal and would like to, they don't need to be in treatment, they just want to get some relief from withdrawal, they can get 24 hours worth of buprenorphine at the Genoa Pharmacy. The pharmacist works with them and sort of is able to basically know that they're going through physical withdrawal, ascertain that, and then is able to provide Suboxone. The other thing that Genoa is doing, and this is in coordination with the study, which is a study that I'm running called the Mount Farm Study, people can actually begin treatment at the pharmacy in collaboration with a physician. So it's a telehealth visit with the physician in coordination with the pharmacy. So that means that they can go to they just walk into the pharmacy and they can begin treatment. As long as they're also willing to do the study, which is basically just looking at how this is going. Having access to treatment in that way is new. And basically the purpose of the study is understanding that accessing treatments in this way is comparable to going to a clinic setting. So I will send the flyer to let people, so people can have more information about that. Thank you.
That's actually very exciting.
Well, for us, we're a pretty resource rich state in terms of having access to medication for opioid use disorder, but particularly in areas of the country where there aren't providers. And of course, it's always good to have as many doors as possible into treatment. So that's always good. But particularly in parts of the country where there really aren't prescribers, if they could expand treatment to be, you can do it at the pharmacy, is going to really mean more access to treatment.
Wow. Well, are they open normal working hours, 9 to 5, or do they have an extended schedule? Or
so they actually are open pretty normal working hours. It's more like an 8 to 5, slightly. So right. So one of the things that's happened with this is that we noticed that when people want to be induced, because this just started this year, it's always on a Friday afternoon, of course, but it works. It works on a Friday afternoon, but not on a Saturday or Sunday because they're closed on Saturday and Sundays.
Okay, great. Okay, anybody else have an announcement? I'm on my iPad and I can only get 9 tiles at a time, so I can't see all of your squares light up. So just go ahead and whoever we hear first goes next.
I see Karen Kaplan waving.
Thanks. I just wanted to ask Michelle if that is in the Randall Square building, that pharmacy?
No. It's in the Providence Center.
Oh, okay. Thank you.
It's in the bottom. So Genoa is actually, you know how Providence Center is really so many stories high. They're in the very bottom floor.
Okay.
So yeah.
So you go around the back.
Exactly.
Thank you.
Anyone else? Rachel, you're my eyes.
I'm your eyes, huh? I don't see anybody else.
Jose?
No, I think we're good.
Okay, I have one brief announcement. I had been talking at previous meetings about Kodak's contract from BHGVH to implement a program using mini medical vans to provide treatment at hotspots and bring treatment to people where it's needed, where they are. Because of circumstances related to COVID, the van has been commandeered, and we have come up with an alternative plan. We're going to be doing, I'm probably not supposed to use this terminology, but we're going to be running pop-up clinics. And we're going to open for several hours on a weekly basis a clinic where we'll do assessment and in some cases treatment with buprenorphine, and provide other medical services to people at identified locations. So we're starting out by working with Crossroads. We'll be setting up at the Harrington House and at the Towers, and at the shelter we'll have an alternating schedule. We'll also be working with House of Hope, and they have the Shower to Empower program. And so we'll be doing one that coincides with that. And I know we'll be doing some work. I'm not sure of the particulars yet, but feel free to jump in, Colleen, if you do. I know we'll be doing some work with Project Weber Renew, trying to get treatment on the street. So I think that's pretty exciting, and it's a good alternative since the van went away. So I did get some outreach from a couple of people on this board about bringing services to their locations or their communities. So please feel free to follow up with me. Depending on our capacity, we can start sooner or later, whenever you're ready. So I think I'll put my email in the chat. All right. Any public comment? Anybody from the community want to offer a comment? Okay, and then Rachel, we're back to you. Did you already do your update, or?
I did not do my update. So director's update. So as I think you all probably are aware, our dear friend Ellen Steinar has left us at the city, and is working on the next adventure in her life. So I will be serving as interim director at least for the next couple of months. We have posted the position and got a number of applications in. So we're hoping to have somebody in place as soon as possible, but we know that that process usually takes at least a couple of months. So be patient with me. Nobody is Ellen. And sometimes if you need to, if you've had a conversation with Ellen, you might need to start at zero with me. I'm doing my very best to pick up where she left off with everybody, but I appreciate your partnership and patience as I work on getting fully up to speed on that. The other update that we have is that Adelina, who introduced herself earlier, has joined our office. Her name is Adelina Atamer. She's serving as the Regional Outreach Coordinator, and she will be with us approximately 15 hours a week. And I wanted to give her just a little bit of an opportunity to introduce herself, talk about her background and her work plan. Adelina, do you want to take it for a minute?
Yes, of course. So I am Adelina, and I am very honored to have the opportunity to meet you all and have this time to tell you a bit about what I've done in the past. So I used to work for the American Lung Association, so very closely with tobacco and COPD, and also with the Providence School Department. I was working in a yoga initiative just for the betterment of lungs, and it was very exciting to be able to network and meet everyone from that department, and that kind of sparked my interest into public service, and that was what made me want to take on this role and work towards healthy communities, and having that mentorship also of Obed and Rachel, and also getting the opportunity to meet Ellen was absolutely incredible. And I hope to get to know you all better and grow that relationship, as well as really make a stamp on my role.
Thank you. So join me in welcoming Adelina. We're really excited to have her. She has a lot of great skills and background. She also has a number of languages that we think are going to be very helpful. It's a strange environment to be in right now, doing outreach coordination when everything is over screen. But I think Adelina has some great ideas for, especially as the weather starts getting a little warmer, how to creatively engage families and youth and other community members in safe ways in the outdoors as well. So welcome, Adelina.
Thank you so much. I look forward to it.
Let's see, another update. I think you all at the past meeting had a chance to meet Tanya Gilbert, who has come on as our PFS coordinator, working on youth alcohol and tobacco. And I wanted to give Tanya just a quick minute to say hello and maybe give a quick update on your work, since I think you've just sort of dived in maybe since the last time we all met with these folks.
Hey everyone, yes, I'm Tanya Gilbert and I'm the program manager at the Healthy Communities Office. I am primarily working on the PFS grant for alcohol and tobacco prevention. And so I am doing a deep dive in getting to know about prevention. Right now, currently, what we're working on is adding to our coalition. So I have been communicating with youth organizations to see if we could add some youth to our coalition to get youth voice. And I was really looking forward to today's report so I could ask a few questions as I have read that, but I'll have my chance to ask further questions. So we're looking forward to adding some youth voice, and I just wanted to kind of hear about the types of businesses that you were looking to add to the coalition as well.
Tanya, do you want to ask that question? Do you want to open that question right now, or do you want to find time to talk about it with people individually later? What would you like to do?
Well, I don't, I guess I could open it up now. So as I was reading through the survey that you all participated in, one of the areas that, well, there's two areas that you asked, thought we could increased representation of, and that was businesses, and the other one was safety. I realized that you didn't have youth on there, but part of the grant application for SAMHSA was that we have Youth Voice also added to the coalition as a subcommittee. So I just wanted to hear from you all, like, what type of businesses were you looking to have become involved in the coalition? And safety, you know, what were you thinking about there as well?
Carolyn, you're raising your hand.
Well, in terms of businesses, there used to be a representative, somebody who owns some nightclubs in Providence on the board. And it was very interesting to hear to get his insights about what was happening in the community. He was very supportive of the work we do. But we got to look at the other side. And I'm on several of these regional coalitions. One of them has someone who owns a liquor store, which is interesting. And he also gives us sort of the inside perspective, but he participates actively in sticker shock campaigns and things like that. So that's an interesting voice as well. Just throwing it out there.
Thank you. I appreciate that, Carolyn. Anyone else?
Karen?
I'd like to say I'm glad to see the police department is here today, because I think that's a part of our safety, having the public safety officers involved. And so thank you for joining us. And I also would like to see some retail businesses, particularly in some of the harder hit areas with overdoses and drug problems, such as the corner up at Smith Hill where the 7-Eleven is, and Douglas Ave, and some of the proprietors maybe down in the down city area. So they could give us a unique perspective, I would think. Thank you.
That's great.
Thank you, Karen.
I think also in the past, and I know we continue to have here and there like youth participants, I would like to that be a robust participation on the youth in our school or colleges to get their perspective in the coalition. That would be good to get, you know, their views on what's going on in school with the issues that we have here.
Thank you.
I agree. I had formerly been on the Johnston Tri-County Coalition, and we had high school students participate in our meetings, and it was really it was a nice way to partner with the youth in the community, as well as to get their, you know, inside perspective on what's going on, and how we could be partners with and you know, help facilitate some of the energy that they were trying to do as young people.
Yeah, we have done it, and for a period of time, it was a little consistent, and then it kind of went away. So it's being sporadically. That's something that I think we should continue.
Okay, we have a bit more agenda to work through, but I would definitely love it if folks have other ideas for those businesses and other stakeholders that Tanya should be reaching out to. I think either reach out to her directly or maybe even just drop them right in the chat as we go, as you think of them. That would be great. All right, Tanya, do you have other things you wanted to share before we keep going?
No, I think I will wait so that we can get through our agenda, and when Dorothy comes to present, I can ask more questions. Thank you.
I think you may have missed in the beginning. She's not going to be presenting today. So, you're saying when she will present in the future. Okay, yeah, right. All right, so hopefully
we'll be here next month in March.
Okay, great. Thanks, Tanya. Okay, I have a couple of more announcements. As I think this group has talked about a couple of times, the city issued a request for proposals for a planning process for a behavioral health police diversion program. This is sort of the first step in working to develop an alternative emergency response around behavioral health. The proposals were opened this past week on Thursday. We were very happy to get 5 proposals. And so we're going to be reviewing them over the next week or so. We hope to have a contracted agency on board by the second week of March. We are convening a panel of a variety of people, from city staff to people in public safety, to community members and people in different organizations. So a couple of people I think on this meeting are going to be serving on that panel. Chief Kenyon, please check your email. So we look forward to hopefully being able to announce that to everybody in early March. And I think it's going to be a great process. And I'm sure as that process gets rolling, whoever is engaged will probably be reaching out to a lot of you to kind of get your input as stakeholders and informed expert on this topic. Another announcement that I want to make is that next Tuesday at 10 a.m. we'll be holding the Downtown Overdose Stakeholders Meeting. So that's specifically the state hotspot overdose strategy, AKA Code 3. This is the new turn in code funding, convening people especially concerned about and involved in the issue of opioid overdoses in the downtown area. So that is at this point in month, it's going to be a monthly meeting for a couple of months and then probably bi-monthly after that. If anybody wants to join, please drop me a note and I'll make sure that you get on the invite list. On our agenda next week, Department of Health is going to be sharing some quarterly overdose data for what's been happening on the ground in Providence in the last quarter. So that should be particular interest to anybody who wants to join. Just let me know. And I think that is the extent of my updates for now, Carolyn.
Okay, I was just entering something into the chat, but let's see. So Detective Doucette, would you like to say anything more? Are you part of this program that Rachel just described?
No, I've not
No.
worked with Detective
Oh.
Doucette. I believe that he was going to be giving tobacco and alcohol enforcement updates.
Oh, okay, right. That is a different topic. Okay, so we invite you to speak and would love to hear what you have to say.
All right, you can hear me, right?
Yeah.
Okay, all right. My apologies, we're in the office, so if it gets a little loud over here. Yeah, basically we've been going out there and doing tobacco checks at numerous city establishments and with an underage assistant. And the process that we use for that is they go into the store, they attempt to buy a tobacco product, and then if they get it, out with it, and then we go in and then we would have to cite the employee that actually sold the tobacco product. What we were seeing is before COVID, we were getting about, I'd say approximately 4 out of every 10 checks were being sold. So we're getting purchases at a pretty high rate. And with COVID, with the masks and everything else, that number is definitely lower than half of it now. So they are still selling. And we're not trying to be we're not trying to, be tricksters or anything like that. I mean, we send somebody in, she's 16 years old and no ID, no nothing. And they go in and they're pretty much just selling. So even with the mask, and she does look extremely young. So this is kind of more on their side. They should be picking up on this, but we're seeing a reduction, but it's not as significant as we're hoping, especially with the masks. We're figuring that everybody would get ID'd at that point. We also do the alcohol enforcement, and we kind of go tobacco, then alcohol in a rotation. That way, if the word gets out that we're out there, and we kind of switch it up a little bit. So same thing with the alcohol. We send them in restaurants, bars, clubs, liquor stores, any place, Dunkin' Donuts Center, if they had an event, any place that has an alcohol license and serves alcohol in the city, that they're kind of thrown on a random list that we get from the healthy community offices. And we just kind of same process there. And then if they sell to the underage, we actually go in and we have to write up the person who sold, and we send the business that bought licenses. So they have to face the music with them as well. But yeah, I mean, we're still out there. We're still doing them. And like I said, the numbers aren't as high as, they were pre-COVID, but I guess that's understandable.
The alcohol's been a little difficult with the COVID-19 restrictions. But they should be still asking for ID. I know with the mask, it's kind of tough, but you're supposed to ask anyone under looking 30 for ID. And some of them haven't been doing that. So, but with COVID restrictions, it's tough. They close the bars, so it's kind of tough when a young person comes in, sits at a table. That kind of gives it away a little bit. So, but we're still trying. There's still several places still selling alcohol to the kids. So.
One of the things that's been coming up is that a lot of restaurants now, as well as retail liquor stores, have been delivering alcohol to homes.
Yeah.
And that increases the challenge. There's really nothing you guys can do to monitor that. And, the problem is some delivery person who really, may have some very basic training, if anything at all, arrives at the door and hands off a package, and they really can't demand ID effectively. So that could be one of the reasons you're seeing a decline, because apparently there's a fair amount of this going on.
Yeah,
in
so
some communities.
Yeah, so we normally, there's obviously the known liquor stores in the city that are closer to colleges. So we typically will sit on those, and even those numbers of even the college age kids going into those establishments has dropped significantly. And we attribute it to obviously the enforcement we've done at those locations, but also this new way of just ordering online or through an app. And I mean, it's just somebody showing up that who knows if they're really IDing anybody at that point or not, and what the checks and balances are at that point. But we've noticed, we'll sit there and like, wow, like there's nobody showing up to go in there and buy it, which is kind of odd. So a lot of it's a safer avenue, because they know once we start, making arrests for this at different establishments like liquor stores, the word gets out around campus, and then they don't go there anymore. And so it's a constant chess game, but we do our best to try and, prevent it as much as possible.
Yeah, no, I think it's great. Do you guys have a tip line? I know some communities have a line where people can call in to report sales, illegal sales that they've witnessed, or underage parties at private homes, but just, is there anything equivalent to that, Providence?
Well, Providence uses the 311 system, and a lot of our tips come through that, and we get notified of different things through that. A lot of the colleges will actually, their security will call us and say, hey, we noticed the kids are going to this particular bar, or they're going to this particular liquor store. So that they kind of point us in the right direction too.
That's great.
Because there's so many places. I mean, there's liquor stores, every block almost in the city, it seems like. So, it's difficult to stay on top of them all. But yeah, I mean, just the 311 and our active enforcement,
Great.
Anybody? Yep.
I have a question. Did you note the consequence to either the youth or the proprietor?
Yeah, so the youth normally will get anywhere from 10 to 20 hours community service if they go to court. And the actual business owner for alcohol usually gets a fine. So it depends on how many times they've been caught, and whatever's on their record. So it's progressive. So if it's 200, then the next time it's 300, it just keeps going up. So it's different for everybody at this point, depending on how many times they've been caught.
If the bartender sells to the undercover, the bartender gets fined also, along with the business. So the business gets sent to the board of license also.
Who follows the youth with regard to the completion of the community service?
I think that's all through the courts. We don't even get any feedback as far as what each kid gets or anything like that. But it's just the courts that oversee the community service. And they all typically, I think there's a church on Smith Street, they pretty much all get sent to help out at that place. So, which is good.
Laura, and Rachel, you can help me here. I don't know if you know, but from what I've been learning about the grant, we're also trying to make sure that we have education for both the retailer and for the youth. So once they have been cited, Obed was following up to bring education on the tobacco or the alcohol laws, as well as doing curriculum with the youth and their families to prevent alcohol use and abuse.
So the other thing is with tobacco is we kind of lost any city enforcement, well, not enforcement, any city punishments through the board of licenses, because now that's all at the state level. It's all state issued tobacco licenses. So when it comes to tobacco, all we can actually do is cite the actual clerk who sells. Unfortunately, we kind of don't have much to go with on that as far as the business level. So they're kind of getting away on that end.
Wow. Don't establishments that, well, I guess there's a requirement that all employees have tips training in advance. But is that part of the process if somebody sells to a minor? Do they have to go through that tips training again, or is it, you don't know?
It's recommended that they get recertified.
Yeah.
It's not that they have to go back and do it, but we have another person we work with. His name's Frazier, who's very good with fake IDs. The board of license might recommend that to the business, and he gives them a certificate when they take his class.
Oh, great.
Yeah.
Yeah, but other than that, I mean, we've been working right through the whole pandemic for the most part. From I think we started back up in July or so, doing the checks again, and everything's safe, and we've been very successful as far as that goes, thankfully. But yeah, I mean, that's basically our update on our end. Is we're still out there, we're still doing the grants, and we also work with FDA. We do FDA checks as well. That's been temporarily suspended because of the percentage of positive rates here. But but yeah, I mean, we're still getting it done, and because we understand that if everyone thinks that we're not sending people in and doing all that, then it's just going to be a free for all. So we're trying to prevent that as much as possible. So I think that's all we got. Any other questions or anything?
Thank you.
Thank you very much. Chief Kenyon, I don't know, I heard a rumor somewhere that you're working on some kind of ride-along or diversion program. Am I letting the cat out of the box, or is there anything you can speak to on that, or?
Yeah, so no cat out of the box, it's already happening. So I've been trying to push diversion programs for quite a while, whether it be for low acuity medical runs or for mental health. Then, like the rest of the universe, we got sidetracked a little bit with this thing called COVID. But we do have, much like the police department here in Providence, we do have a clinician that's riding on one of our rescues now. And the police department for a long time has had embedded clinicians and family services. So we have one riding on rescue, and we're trying to analyze the need and how we can assess people and get them to the right location. And so, I'm still working on the best ways possible. I do think that, Rhode Island is unique. We can't run exactly Cahoots like Cahoots runs it in Oregon. We need to come up with our own plan that suits us, because we don't have the demographics, the geography, all the resources that they have. So we have to do what works for us. And I do think here in Providence, the coordination with the fire department and the experienced EMTs I have that would like to do mental health, and quite a few of them already have mental health backgrounds and would like to do specifically that role. I think it would work. So we just have to get the right partnership and get the right people moving on it. And I have a lot of input eventually on it. I've sat through a lot of meetings with the Cahoots program and the program in Denver now that modeled that, and also have spoken to a lot with the people in Dallas that run a program that's slightly different, that incorporates police, fire, and a clinician. That's called the Right Care Team. But again, if we can take the bits and pieces that work from everything that we pay attention to and make something that works for Providence, I'd love to be a part of it, and any part to move forward, I think would help. And you guys know I'm always available. I'm pretty sure everybody has my phone number already. But at any time, if you have any questions, just reach out. And I think it's going to be important. I think, the way anything is delivered through the 911 service, especially in our world, the EMS world, the medical world, really is dysfunctional. So we need to really get back to basics and get the right resources to the patient, and then get the patient to the correct resources for the needs. And I've been told by a lot of people in the medical world that it's very complicated, and I disagree 100%. I think people are making it complicated, and we need to make it simple and just help people in the most basic way possible.
That's great. Keep us updated. I did attend the Cahoots training and I was very impressed by what they're doing, but I understand that we already have things happening in Rhode Island that, and things are different from one community to another. And I know you've got a very proactive program going. So keep us, as you do this analysis that you were talking about, let us know what's happening.
Yeah, and we do have a local connection. There's a young man, Daniel, that's going to Brown Medical School that did work in the Cahoots program. So he's been great. I've met with him a few times already to kind of weed through the things that are vastly different there. And I think one of the biggest items there is that they really don't transport a lot of people. Rhode Island is kind of stuck on transporting everybody somewhere. And so they don't transport a lot of people, and out of the ones that they do transport, I think they said 40% of their calls end up being transported, and out of that, about 10% get transported to some sort of medical or mental health facility. So very low number. They really try to help people on scene more than anything. And I think that's something that's going to be a culture change in Rhode Island, because we're stuck with liabilities and medical clearance and all this other stuff that eventually tends to get aggravating for the patient, especially in the mental health crisis, where we're really there just to help them.
Great.
Thank you.
Thank you. So anybody else have any comments or questions on any of the things we've been talking about? No? Well, we can move to a general open discussion about COVID-19. Oh, sorry.
Lisa is trying to speak to us, but she.
Hear me now?
Oh, yes, I just heard you.
Okay. Sorry. When you're on different platforms all day long, sometimes it rejects the one you're on. Can you hear me?
Yep.
Yep.
So I had a question actually for the police officers. I was just wondering, and I fully understand how complicated our systems are to navigate, and that one level does not necessarily speak to the other. But I was wondering if there is any opportunity or at this time, or maybe in the future, for you to be able to coordinate your efforts. As you were talking about, it's difficult for you to get the licensure piece because that's been moved to the state. But taxation has their folks that go out and do their inspections for taxation. And I was wondering if there's any kind of an opportunity for the city to be able to collaborate or leverage what the state is doing and be able to work together from getting at that license piece and the fines.
Yep. So we have worked with taxation. With unstamped cigarettes or things of that nature. We get involved. We just recently did an operation with them on Elmwood Avenue at a place there. So yeah, we do that end of it. It's and what we see is like the DVR goes out with us sometimes. They'll call and meet us out and go into different locations. But other than that, with the taxation, we only get notified if there's some sort of investigation that they're doing in the city. And then we kind of help them out because we have to do all the seizures and we do the charging and warrants.
Yeah, so I do know that it works that way but that's sort of, in my opinion, a one-way relationship, right? Like they call you when they need help. And so I guess my question was whether or not there's an opportunity for you to actually make that more of a two-way relationship, that the city's actually able to also benefit from not only the perspective of people who don't have a stamp, but more, I mean, to the importance of this group, that youth are not having access to tobacco.
Yeah, anytime we get buys with the youth, we could send over, like, we work with Danny Sarzillo several times. We could forward him our police reports and let him know what places are selling to the youth. We could definitely do that. And then see whatever he could do up on his end. That would be actually a great help also.
Who's got something in the background? I hear a lot of.
Yeah, it's probably us. Let me mute us.
Oh, no, I'm sorry. Oh, that was it. It was you. All right. Anybody want to talk about challenges, issues, concerns about what's going on with COVID and how it's impacting the work we do?
No COVID comments. Lisa, do you have
I'm gonna make
something?
a comment. Yes, I am, because I think that, I don't know if Soleil is still, oh yeah, there you are. Last year, the Hospital Association did a lot of really great work with the Providence school system. We were involved working with a number of middle schools, Nathaniel Green and ASIC Hopkins, as well as some work at the Met with our campaign to change direction. And this pandemic really has highlighted not only, our substance use disorder crisis that we have, but also the mental health crisis that we have. And really it has amplified what was already happening in the community. And young people in particular have been significantly impacted by what's happening, with the pandemic, whether their families, they've lost family members, to COVID. They have family members who were barely employed before and now are completely unemployed, worried about, where they're going to live, where their next meal is coming from. And it really has, for us, because of the type of work that we were doing with students and using health class as the vehicle, that resource sadly is no longer available to them. And so I think that that's, it's something that was expressed as a need in the community, and particularly by young people. And we've really struggled with being able to try and maybe get that back up and running. And so, we do hope that maybe we can, work together, have some conversations, figure out how we might be able to address that. Because I do hear a lot of talk even within this group about prevention when it comes to the tobacco and substance use. But we really need some tools for young people to deal with mental health. We all know, everybody who's been in this industry, for 5 minutes knows that mental health issues, lend themselves to people self-medicating, using alcohol, drugs, and other things to make themselves feel better, which lead to other types of disorders. So I don't know, I guess that's my concern, my challenge that I've had with COVID-19 and trying to continue to work with young people, helping them find tools that are identifying when they're in trouble, but also knowing what resources that they have, self-resources that they can depend on to get better.
I'll quickly address that if everyone has a moment. I do have a meeting coming up soon, so I'll hop off fairly quickly after I'm done. But our district has continued establishing partnerships with other partners in the area. We have new members on board who are overseeing the mental and behavioral health of our students. At the last meeting for this Mayor's Coalition, we actually had the Ginn Consulting Group come in to talk about the smart clinics that have opened up at 3 of our secondary schools. These flagship clinics, school-based mental health clinics, school-based health clinics, are actually hoping to expand with additional funding. We also have a team of social workers, school psychologists, mental health behavioral specialists, and managers who are always trying to reach out to our students and our families. But given that it's an urban area, it can be very, very challenging. So we are making some headway, some leeway. We have been working very similar to what you did, Lisa, at Green, in kind of transforming our schools to feel like more welcoming spaces, building connections within the community. We have new leadership in many of our schools. So we are now guided by a different set of planning. We are now part of a turnaround plan from the state. We do have different priorities in place, but we have always remained committed to our students' mental and behavioral health and their overall wellness. So this is all in the works, Lisa. You can try to reach out to our partnerships office and see if you can build a connection with any of the schools. A lot of partners are still kind of we're still struggling to have different partners on board, just given the need with the COVID-19 pandemic and everything that's underway. Rest assured that we do have in place several grab and go meal sites, so our students will always have access to food. We also leverage the community partnerships that we have with the city, and meals are being delivered as well. So we are doing our part to do the best that we can, but with 24,000 students, the challenge is still there.
Well, thank you. Certainly, I didn't want that to sound like you weren't doing something. It was much more just a challenge that you have when you're used to delivering a service in a particular way. So really, to express to your point, I think that you're doing good work. But certainly, if there's anything that the Hospital Association can do and partner and continue the relationship that we built, we want you to know that we are interested in doing that, and that goes for any of you as well.
Okay, great. I'll be glad to connect you, Lisa, to some of the new people who are on board, and maybe you can have a follow-up conversation and see what types of supports you can offer to our families and students.
Okay, great. Thank you.
Hi, everybody. I have a concern. First of all, I stopped the video because I have to take a phone call, but I didn't put it on mute, so you probably heard that a little bit. One of my concerns through COVID that I found is like working with our elderly remotely is very difficult, because either they don't understand the technology or they don't have it, or both. And that has been very challenging because, when you are on site, they come to you. If you need to do something, you can do it right there. They can show it to you right there. So that has been challenging, working with our elderly. And that's something that I have to say, because I know we're moving towards everything is through the internet or cyberspace, and everybody has to have an email. Even when I was in the buildings, I always say, okay, this is where we're going, but we need to remember that some of our elderly, even if we provide classes, even if we provide certain things, they're not gonna get there. So and this has nothing to do with COVID, even before, as we're going in through that era, there should be a transition plan, like those people who will never have access or understanding, they shouldn't be left behind. And right now, everything is like, nope, you have to have an email. Nope, it has to be done online. And during COVID, that has been even more difficult, because sometimes they call me and they'll be like, I don't know what it is that you're looking at. You cannot even send me an email or a picture of the document. So that has been a challenge.
Jose Luis, I work with Annette Alves at Federal Hill House. I don't know if you know Annette, but she runs the foster grandparent program there, and they've been running the program all remotely. So she's definitely been encountering so many of exactly the same challenges you're having. She's had some success with getting people up to speed on technology, running the exercise programs and things via Zoom, but it's definitely a huge challenge.
It's a challenge, even for some of our seniors who have computers, even those who have been using computers, because we know, like when this started, I have no idea how to use Zoom. And some of us even though we use computers and we're somewhat technology savvy, there are some things that we don't know. So even those that know how to use it, they've been having a hard time.
Yeah, I agree that we can't. It really is a shame, like so much of all the resources that have been made available during this pandemic are all dependent on people already having a certain level of resources, right? Already having a certain level of computer savviness. mean, those of you with older parents, I would say mine aren't even, mine are fairly savvy. They run their own business, and having a Zoom call with my parents is,
I think if we learn something from this, if we were to go, I mean, we haven't get out of it yet, but if we're going through, go through something similar again, what is the backup plan for that? Because we cannot count that everybody will be connected. As much as we try, as much as we offer classes, that's going to be a challenge. So what's the backup plan for that?
Yeah. I think that has called out so many of our shortcomings in so many ways, and if we come out of this and haven't figured out how to address those, we will have wasted an enormous opportunity for change, right? Yeah, I agree.
Kodak faced some challenges, but we switched to primarily a telemedicine model. We got a grant that enabled us to purchase phones and phone plans for some of our patients. Some of them didn't have internet access, so that made things a little tricky. And we did have to do some of the counseling just over the phone, which is not ideal. But anyway, my point is that we're running out of the phones, and the contracts on a lot of them are about to expire, and we don't have funding to continue to do this. It looks as if this pandemic is going to continue indefinitely. So I know that other agencies are running into, we came up with what turned out to be a short-term solution. But I know that there are probably other agencies who are dealing with the same thing. We have ideas about how to do this, but we don't have the funding or the resources to implement the programs that we've been able to put in place or to continue to implement them. So just mentioning that.
No, that's a great point, Caroline, because I just remember something we've been doing also, things through the telephone, but a lot of our residents, they count on the government phones that only come 300 minutes. And during the pandemic, everything has to be done through the phone. In a week, they could just use up all their minutes.
Yeah. So it's a challenge. I mean, we're still going to have to come up with creative solutions for quite a while going forward. And I think, as somebody mentioned, that some of these things will remain in place at post-COVID, if there ever is such a time. So we've got to figure out how to make these things accessible, affordable, and effective. So, anybody else want to contribute? Just let us know about issues you've been facing, things you've learned. No? All right. Is there any new business? Is there anything that anybody wants to introduce to the record, into the conversation? So since nobody's speaking up, I just thought I would mention, this is not really new business, but there was a national prevention conference last week. It's called the CADCA conference, and I attended. Obed was there. And one of the highlights of the conference is the opportunity to meet with your state delegation, representatives of your state delegation during the days of the event. So in the past, this happened live. Everybody would go up to Capitol Hill and meet with Senator Whitehouse or Congressman Cicilline, or this year it was done virtually. And because of everything that's going on Capitol Hill right now, most of our legislators couldn't make it themselves. We had Jack Reed for about 10 minutes. He got called back to the Senate for a floor vote. But we were able to talk to their aides, who are very informed and very supportive and very engaged. And I just wanted to report out on one thing that I learned that I thought it was encouraging and might be helpful to some people. When we talked to Senator Whitehouse's aide, I'm sure all of you know that he was one of the architects of the Comprehensive Addiction and Recovery Act. did I reference that earlier today? I've been in so many meetings today, I don't know what I said where. But so that was the CARA bill, and they're currently working on a CARA 2.0. And they were very interested in issues that we're confronting, things that didn't work. The first CARA, for example, there are some loopholes that insurers have found in terms of paying benefits. There's some parity issues for substance use disorder and mental health treatment. So if there's anything that has occurred to you, I know that their offices are open, available, and eager to hear from constituents. So, if there's anything you want to let them know. I'm not sure when they're going to release the new version of the bill, but we do have an incredibly engaged and supportive delegation here in Rhode Island. And they really want to make sure we get more money, but that we also get policy changes that help us with the work we do. So, just as one example, I think I might have mentioned this here before, but tobacco treatment or tobacco cessation treatment is mandated in the Affordable Care Act. It took a long time to get insurers to pay for the treatment that they were supposed to pay benefits for patients who are seeking treatment. In the meantime, they figured out that they didn't have to, that somehow there was a loophole and they didn't have to pay providers, or they didn't have to reimburse them at a level that made it possible for us to provide the services. For example, if we do a 10-minute counseling session for tobacco cessation, we get $11. If we do anything over 10 minutes, from 11 minutes to an hour, we get $14. So we can't provide the services. We have trained tobacco treatment specialists, we have programs ready to go, and we're stuck. We can't do it. And currently there's only one place, I think, that's offering evidence-based tobacco treatment right now in Rhode Island, and that's Thunder Mist. They have a very small program, but they've got something. So I was able to speak to that, and they were very interested in those kinds of loopholes. That's the kind of thing they want to hear about, like what slipped through the cracks and why aren't people getting the services that they need, especially when they've been mandated or written into some of this legislation. So just a thought, if anyone wants to, all you have to do is call their office and they put you in touch with the person who handles handles health policy.
Caroline,
Yeah.
I will contact you to get more information about that Thunder Mist cessation program, because I recently
Sure.
spoke to one of my residents about that, but I don't want to take all the time here. So I'll contact you about that.
That's fine. I don't know a lot about it, but I can refer you to the contact person there.
Thank you.
Sure. So is there anything else anybody wants to say? We're approaching 4 o'clock, or is it 4 o'clock? Oh, 4:03. So we actually made it to our projected deadline, a revised deadline. So if nobody has anything they want to add to the conversation, we can take a motion to adjourn.
I make a motion to adjourn.
Okay, second. All right, well, thank you, everybody. We'll see you in March, and stay in touch with one another and in the interim, and bring all your news next month.
Thank you all.
Thank you.
All right.
Bye.
See you later.
Bye.
Thank you.
What is that?